okay, don't worry. Okay, thank you very much. Welcome everyone to June's meeting of the Local COVID Outbreak Engagement Board meeting. I won't make introductions of everybody in the meeting because that would use up too much time. But if and when you do speak in the meeting, please do feel free to introduce yourselves. Couple of items to changes on today's agenda. First of all, item 10, international travel, will be deferred to a later meeting due to some personnel changes at Birmingham City Council. And then secondly, item 9, the enforcement update. I'd like to take that immediately after item 5 because Chief Superintendent Stephen Chief Superintendent Stephen Graham, as a result of England's victory over Germany last night, Stephen has to go to Rome because he gets deployed for overseas England football matches. It's a tough life for some of us, clearly. Yeah.
If he needs a bag carrier.
Yes, I'd volunteer myself as well. Stephen needs to take a COVID test before he departs. He's got to do that at 3:15 today. So I'd like to move item 9 earlier up the agenda if everybody's comfortable with that. Item 2 then is notice of recording. Just to advise everyone that this meeting is being recorded and will be webcast for live or subsequent broadcast by the Council's new YouTube site. The members of the press and public may record and take photos except where there are confidential or exempt items. Can I just ask that anybody wishing to speak during the meeting indicates by raising their electronic hand or by posting something in the chat. And please could you keep your microphones and videos off when not speaking in the meeting. Thank you for your cooperation. Item 3 is apologies, and there are a number of apologies. First of all, Councillors Bridget Jones and Paulette Hamilton, then Stephen Raybold, Paul Jennings with Morag Gates substituting, Dr. Mania Aslam with Dr. Parmjit Mara substituting, and Richard Burden. Does anybody wish to submit any other apologies? Okay, we shall note all of those then. Item 4 is declarations of interest. Does anybody wish to declare an interest in respect of any item on today's agenda? No. Item 5, minutes. Are we all happy that the minutes of our meeting held on the 26th of May are an accurate record, and I will sign them then in due course?
Great.
Silence as agreement. Thank you very much. I'd now like then to take item 9 next in order that Steve can get away to take his test. Item 9 is the enforcement update, and we have Mark Croxford, Head of Environmental Health with the City Council, and Chief Superintendent Stephen Graham from West Midlands Police, who are going to present this item. Mark, are you going first?
Yes, thank you, leader. I too have worked really well with Steve, so if he needs a bag carrier, I'm more than happy to work well with him for that. I think everybody's going to say the same. So yeah, very jealous. COVID Marshal, sorry, I was just going to share my screens for the presentation and fire it up. Ding, 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 ding. Hopefully you can all see that now.
Yeah.
Just try and get it slightly larger. There we go. Right, so the COVID marshals, they've continued to work for the last month between the 15th May and the 16th of June, which covers the period of the report, leader. We've given out another nearly 10,000 masks or face coverings, which brings a total to 44,000 face coverings being handed out. Again, it's a really good icebreaker. It's this way of going up to people and saying, if you've forgotten your mask, would you like one? Is much easier than saying to people, please could you put a face mask on, and it's working really well. they get really good reception on that side. We continue to do high street patrols. We also go to schools where we're asked to attend if they've got problems with queues outside the schools waiting for children to come out, particularly at the end of the day. And we're doing quite a lot of work around where there's large gatherings at religious established food banks. And again, they're being invited out to those. They were in and around the or around the area of the cricket ground earlier in the month when we had the test event, which went off very successfully. And again, they were handing out masks and giving advice to people who wish to receive that advice. In addition, we also had some really positive work going on around the two schools in Hall Green, where we had an outbreak of the Delta variant, and we got really good feedback from the heads of both schools, and they've also been working in the Selly Oak area, responding to the high levels that have been coming up in the last couple of weeks in Selly Oak. We've also got, as you're aware, COVID marshals in the parks. It's the same team, but they're just managed slightly differently by the Parks Department. The parks are pretty good. They've been running about 80% compliance. There are a few parks where we have regular problems, and again, we're working with the police on those issues. In general, the non-compliance in the parks where it occurs is that there's gatherings of greater than 30, and they tend to have a little bit of organisation behind those ones, but in general the parks work is going really well. I'm really pleased with the efforts that's going on there. With regard to the environmental health side and the enforcement officers that we've got within environmental health, both enforcement officers and EHOs, we're still out doing proactive patrols. The interesting one with the two photographs here is that the distillery is set up well for the football, and on the Saturday that we played the football, the lower picture was actually a shot of the crowds that were queuing at 7:30 in the morning, and then we're basically getting a space for the game that occurred in the evening. There was quite a lot of problems around the sheer number of people that were there, and the police were in attendance and led very much on it. But what was really pleasing is the distillery itself and on the premises was really well managed, and we got really good feedback from the officers who were in attendance. It was much more about the queuing to try and get a space to be at an event, which shows where the demand was. We're also looking at more places than we've ever looked at before: bowling alleys, cinemas, soft play areas, and giving advice. 50% before we go are pretty green, but then we're giving advice to the 40% and the 10%, which are red or amber. By and large, we then return to the red ones to bring them at least to amber, if not green, if we can. But most of that, if not all of it, is still being done on advice, and that's working well. As you're aware as well, we're also working with some hotels about COVID security as well, on the setup of those hotels and the operation of the hotels. Test and trace is going well. We are making visits and great strides forward with, I haven't changed the screen, making great strides forwards with the police. We've gone out and done as many visits as we've needed to do. We've made 100% of the contacts that we've needed to do to make sure that people are isolating. We are triaging them, so if we can talk to people on a home line and they are at home, that's great. Where they don't, we'll go and knock doors. And to give you an example, we did 100 visits in a 48-hour period, asking people either come to the door or show their face at the windows. Unfortunately, we still have a small percentage of people who don't isolate, although they've been told to isolate, and West Midlands Police have issued a number of fixed penalties for those now. Continuing to work with the faith groups, this has been really well received, and I'm very, very pleased with the social media coverage that we've had from this. We're trying to do our best to try and keep faith groups open and not have any outbreaks there, and as a result we're working and giving advice, and that's going down really, really well. In addition to that, we're also giving out compliance certificates, and working on trying to support the faith settings. So of the 400 we're aware of, we've been around 290 of the premises, and again we've ranked them green, amber and red, working particularly hard with those that are red. But the really nice thing is, once we've got them into the chartered status, we've then got this list of things that we can we've previously purchased, which they can access, so they can use Zoom licenses, webcams. We've got cleaning materials that they can use. We've got disposable prayer mats. So there's lots of work going on, and really positive work, and responding to requests from the groups and what we can do to support them. And in the last bit of enforcement that we've had to do, unfortunately, is that there's still some premises such as nightclubs and shisha bars which are closed under step 3 on the roadmap. That was extended for a further 4 weeks. Unfortunately, we're seeing a number of shisha bars now which are open. This is where they share the pipe, so they're passing the pipe from person to person to person, and obviously there's a real risk of spread of COVID from that. This is one premises where they've had a number of fixed penalties. They've had a number of £10,000 fixed penalties, and we work with the police to go in and to seize their equipment. Unfortunately, they still replace that equipment and are continuing to trade, and we're working with government and others to try and see other ways of trying to get compliance, bearing in mind the number of weeks that are left. But that was a good operation between ourselves and the police, and that will continue if necessary. Leader, the remainder of the slides are the statistics, so if it's okay with you, I'll stop at this point and just take questions on those.
Yes, thank you very much. Steve, do you want to add anything?
Not to Mark's part, I've just got a few bits and pieces in terms of police enforcement, if that would help Council.
Yeah, I think we can go on to that, because I'm not seeing any hands at the moment, but we'll come back to questions on both after you've done your bit.
Excellent, thank you. I don't have any slides per se, but within the delegates pack, on my written report is contained on from page 96 onwards, and in that I describe that we've continued with the same 4Es approach, which people must be sick to the back death of hearing about, but it has been something that we've consistently applied, so that we do continue to treat all people across the city with dignity and respect, and only using enforcement as a last case. And so, building on what Mark's described there with that shisha bar, we do try to give people the opportunity to change their behaviours through, all of that engagement. But ultimately, if people won't comply, then we do enforce on them. Clearly, this term of the report covers a period when we've been in step 3, and so there have been fewer opportunities, might be the wrong word, but fewer chances for people to break the regulations, because so much of indoor hospitality has been open in addition to the outdoor hospitality, that the size of gatherings has increased, and so we always expected the level of enforcement to decrease. What we've also seen, fairly happily, has been that the number of large-scale protests, which, whilst they do take place in the open air, do offer the opportunity for transmission to take place. And anyone who's seen the figures that have come out this afternoon around the number of Scots who appear to have caught the disease whilst attending the England-Scotland game is quite interesting. And so we're actually moderately pleased that we've seen a reduction in the size and the number of protests in Birmingham city centre, because Victoria Square was becoming a bit of a rallying point for all sorts of protests that have been occurring. And so in one sense, we've been seeking to start to try and dial down some of our enforcement activity. However, a few weeks ago, when Birmingham was placed in the enhanced support status, we wanted to show that we were going to help in terms of this last final push, hopefully, against the virus. And so we had some funding from the Home Office, and we've used that to resource 4 double crew cars on earlies and 4 double crew cars on lates, specifically tasked with COVID enforcing. And so they've been linking in with the office of the DPH, they've been linking in with Mark and his team in environmental health enforcement to make sure that we were focusing on those 10 to 15 top wards where we were having the greatest degree of transmission, or as Mark said, in some of those cases, when we were having some flagrant breaches of the rules and the regulations. So that's what we've been doing. In terms of the excuse me, the number of directions to leave that we've recorded, in the last 4-week period, we only recorded 126, which is a fraction of what we were giving out per month 3 or 4 months ago. However, what's still interesting, if not disappointing, is that those 126 directions to leave actually impacted on 2,165 people. So what that tells us is that we're still seeing, as Mark described there, in the pseudo nightclub space, is people who are hosting unlawful gatherings, because that equates to just over 17 people affected with every direction to leave. And if anyone's ever seen any of the body-worn footage or the cameras from our drones or helicopters, you'll see what we would describe as a starburst, where dozens, if not hundreds of people suddenly come surging out of a premises, and it's not practical or proportionate for us to try and capture everyone or start striking them with batons and so on and so forth. But what does happen in that case, when I spoke about that 4E approach, people who are attending those unlicensed music events, they're getting fixed penalty notices straight away. There's no education, there's no engagement there. It's straight enforcement, and so we're seeing a significantly higher proportion of fixed penalty notices that are issued at those events. Now, in terms of the people who are attending those events, they're having a bit of a knock-on in terms of the proportion of ethnic minority directions to leave that are issued. We keep data, and if you like, we score that the likelihood of being a white person issue with a direction to leave compared to another white person is clearly at 1. When we look at the Asian population, that ratio drops to 0.2. However, the black population, the ratio sits at 7.6, which is an increase of 6.8 from the last time I reported to this group. What we're seeing is that the young people in particular who are attending those large unlicensed gatherings are coming from the black community across the city, and it's that's having an impact on that disproportionality of issuing of directions to leave to the black community, whereas the Asian community is significantly lower. The black community is significantly higher, and that is predominantly based on the fact that that it is young black kids who are attending these unlicensed music events. And the reason why that's interesting, and why we, if I'm honest, we hope to see the Asian population increase, is that when you look at the 10 to 15 wards that were having the higher outbreak levels, and I know that Dr. Varney will probably give some of those statistics later on, they are from areas that have got a significantly higher Asian proportion within their communities. And so I do want to be open and transparent when it comes to that ethnic minority breakdown, but that's pretty much the background to those figures that Mark's been kindly presenting for me. And I'll stop there and take any questions, Councillor.
Thanks very much, Steve. Councillor Paul Tilsley.
Thank you. It's just one question to Mark. As far as the shisha bar notices are concerned, have any of them been paid, or are we going to have to resort to the courts?
Currently, we're looking at court action, Councillor. No, they're openly being contested. What we did do, though, is that we had a visit from the Cabinet Office, which I think you're probably aware of, leader, on Monday. So myself and the police, we took them out. We did safer travel, but we also took them to the 2 shisha bars in question, and actually gave them some space to talk to the management there and for them to put their views over to the Cabinet Officer, because obviously we gave our side when we were in the transit van going from site to site to site. So yeah, they're adamant that they feel that they're being picked on. It's what the legislation says. There is a real risk of spread because people are sharing the ends of the pipe. It goes from mouth to mouth to mouth. People don't tend to use a tip in it. So as a result, it is high risk. And unfortunately, we are at the point of, yes, we'll issue the FPNs, but I think we're going to be in court with them.
Okay, thank you.
Thanks, Mark. They have been warned, and we have been for some considerable time now communicating with businesses around the city about the need to follow all of the regulations. So they really, in placing other people at risk, it's quite right that we've taken the steps we've taken, in my view. If there's no further questions for either Mark or Steve, could I thank you both? And Steve, good luck on your trip to Rome. Let's hope you bring some further good luck to the England team.
Thank you, leader. Arrivederci a tutti.
Very good. Right, we shall go back then to item 6 on our agenda, which is the COVID-19 situation update. And Dr. Justin Varney, Director of Public Health, is going to give us a presentation. Justin.
Thank you, Leader. I'm just going to get the slides up for you, but they are published on CMIS, so I'm going to try and keep this relatively brief today and pull out the highlights for the board. So what we are seeing at the moment is that the case rates are continuing to climb. We have seen a small increase in our case rates in our over 60s, but this is an unvaccinated people. And I think the big push, which I will come to at the end, is really on getting people to get the first dose of the vaccine and the second dose when it is due, because we are seeing consistent evidence now that the vaccines that are available provide good protection from death and hospitalization, but you do need both doses to be protected. And we are seeing, sadly, some people who have only had one dose can catch the virus and they can become unwell. So it is important that everyone keeps testing, even if you've been vaccinated, because unfortunately the new variants, particularly the Delta variant, do create more challenges. We have seen some increases in hospital admissions and in intensive care admissions, and there is pressure in the NHS at the moment as a result of the case rates that have been rising now for about a month across the city. You'll remember from previous boards, it takes about a month for case numbers to convert into hospitalisation. So what we're seeing now in hospitals is really a reflection of where we started to see a rapid increase with the Delta variant about a month ago. And we compare, compared to the rest of the Black Country region and the West Midlands, we are in general doing worse in the sense that we have higher case rates, and that's really a reflection that the Delta variant took hold in Birmingham ahead of many other parts of the West Midlands. Much of the initial introduction of the Delta variant did relate to international travel and to that period where there was a delay in red listing some of the South Asian countries. And we saw quite rapid increase from those cases into the wider community and then spread. And we can see that across the city at the moment, that we are seeing a large number of cases in a lot of areas. This is quite different from the pattern we saw back in January, when we had predominantly the Alpha variant, where the rises were more contained to particularly the Hall Green constituency. Kind of central and eastern side of the city was more affected. With Delta variant, that's not the case. We're seeing a much broader spread across the city and some quite rapid increases in multiple areas of the city as this virus continues to spread and continues to threaten lives. We have got a particular spike in Bournebrook and Selly Park at the moment, and to some extent in Edgbaston, and that's very much linked to identified cases in student population, predominantly in private student households. And we have a large number of student households where everyone in the house now has the Delta variant. This is, of course, population that haven't been able to get vaccine until very recently. And this will defer them being able to get vaccine because they have to wait 28 days after their infection before they get the vaccine. So it will impact on some of the delivery there. The universities all have in place emergency accommodation provision, where the unfortunate situation of a landlord evicting someone who should be isolating happens. So there is support from student welfare for students who find themselves in that very difficult position. My hope is that that will start to come down over the next 2 weeks, because it's now in all of those houses, so that there's nowhere else for it to go. And our previous experience of case rate rises in the student population in these areas is they have managed to stay pretty contained. And I am relieved that in both Bournebrook and Selly Park and Edgbaston, our vaccination uptake, particularly in the over 50s, has been very good. So that there is a good level of community protection amongst more vulnerable citizens. And we continue to work closely with the universities to keep this outbreak under control. So just moving forward through the information, as I said, the vast majority of cases in Birmingham are now the Delta variant. It's unusual to some extent to see any other variants in the city, and that's following a pattern where nationally now the Delta variant is becoming the dominant variant in the UK. And we, as you can see from this map, there are cases of the Delta variant across the whole city and distributed across the whole city in all areas, and that continues to grow. We did become an area of enhanced support on the 14th of June, and that enabled us to access particularly more testing support. And we've been going door to door in 15 wards of the city, promoting lateral flow testing, handing out lateral flow testing kits, and that has increased testing uptake, and that's improved our finding of cases and being able to stop the spread earlier, which is a really important part of controlling the spread of the virus in the city. We're also working with NHS colleagues on how we can strengthen access to vaccination. And I'm sure under the next item, colleagues will share some of the innovation that's been going on across the city to try and make it as easy as possible for people to access the vaccine around their normal lives. And that's included evening clinics, walk-in clinics, weekend clinics, more pharmacies opening, pop-ups in churches, temples, gurdwaras and mosques, as well as with community groups working alongside us to increase access. So a huge amount of effort being put in, but particularly into these 15 wards where we have high case rates and low vaccination uptake and low testing uptake. In terms of testing, overall our uptake of PCR, the symptomatic testing, has some hotspots in the city, and that does relate to the outbreaks, but in general it's pretty even. And now most people are accessing symptomatic testing through home testing or through the PCR sites. Lateral flow testing, the rapid test, which is testing, am I infectious today or not? Whereas the PCR is testing, am I infected? So lateral flow, am I infectious today? The vast majority of people are now testing at home. It's very easy to do. The kits can be ordered directly from the government website. We also have a series of pop-up sites handing them out, and also collection sites as well. And we've been running a very specific pilot with our homeless sector partners to enable homeless citizens to access these tests, because one of the limiting barriers of the test is you need to have a phone or a computer to be able to register the results. So we work with the homeless sector to make sure that our homeless citizens have equal access to being able to test to protect themselves and the people in their lives. We also have a network of 104 pharmacies where people can go to do a test. So if they don't feel comfortable or confident doing it at home, you can book an appointment at our community pharmacies to go in and do the test in the pharmacy, where a member of pharmacy staff can talk you through it if you need help and assistance. And what we've seen is that testing uptake is improving, and that lateral flow is finding positive cases and is helping us get control of the spread of the virus. And this I've included as a new slide for the board, just compares where we were on the 5th of June with where we are on the 27th. And although the map on the right, which is the more recent map, is darker, and we are clearly filling in some of the gaps, the bit I do want to highlight is that the bottom range, so that pale grey blue colour, represents a higher uptake of tests per 100,000 population than on the map on the left. So overall, we've seen a really significant improvement in testing uptake across the whole city, and the baseline has risen, as well as increasing it in very large amounts in some of the areas where we've been doing that additional support and additional work. We are seeing overall testing rates are improving, which is good, now improving across all age groups and across all ethnicities. So this is less being driven by, for example, children returning after half term to school. In terms of our case profiles, we have had a very significant increase in secondary school age children and in university and sixth form college age students over the last 3 to 4 weeks. And that has really picked up quite dramatically. And we continue to work with schools and education settings to support them in managing this. We are seeing spread particularly through social gatherings outside of the education setting itself. There's very, very little evidence of transmission in a classroom. And that's generally because in a classroom, people are socially distanced. they do follow the rules, etc. It's a lot of the stuff that happens outside of that education setting where people are mingling and unfortunately spreading the virus. And that means that they're taking it potentially home to unvaccinated populations as well. And as you can see in the age bands, it's very much that 11 to 24 age groups where these case rates are highest. And that's why we have given the advice to school to suspend transition days to avoid the mixing between different schools. The universities have been doing similar things to move their open days to being virtual and to minimise attendance at graduation, for example, to make sure that we can limit the spread of the virus in these age groups and avoid it spreading further into the community. Moving on in terms of ethnicity, again, there's been quite marked increase in the proportion of cases in our white community compared to other communities, and I think that very much reflects some of the change in the way that the Delta virus is spreading. Fortunately, at the moment, that is not translating into hospitalizations, large-scale hospitalizations or deaths of children and young people. However, it does happen, and there have been cases in which young people and children have ended up in hospital with COVID and unfortunately have died. So it's important to say, although the risk is lower, it is not non-existent. And we also have yet to see what happens around long COVID and children and young people. The initial data coming through from the long COVID clinics is suggesting a slightly younger age group than you would have expected. So certainly people in their 20s and 30s with quite serious long COVID symptoms. But we've yet to really understand what long COVID might do and look like in terms of children under 18. What I do want to just highlight from this diagram is that the very high case rate in our Black African community, which is one of our least vaccinated communities in the city, and I think does correlate with what Steve Graham was sharing from the police perspective and the dispersal information that we have. When we've looked into this, actually it's very difficult from the information we have from the contact tracing service to explain it. The rapid rise in the Black African community does not link back to schools or particularly to households, and it does reflect the demographic that Steve was describing in terms of being younger. So that may well explain why we're seeing some of this rapid rise in that community, and it's a particular threat to the community because of the very low vaccine uptake in the community. So I am quite nervous and not particularly positive about what that will then translate to, unfortunately, in terms of hospitalizations and potential deaths. Moving on, the NHS situation, as I said, is progressively getting more difficult. It is nowhere near where we were in the early spring, but it is increasing steadily. And I know in other parts of the region, they have seen hospitalisation of younger adults in a way that we weren't seeing previously. So we continue to watch this closely for any signs that the Delta variant is becoming even more dangerous to younger adults, which reinforces why it's important everyone over 18 gets the vaccine, because we're not confident that there is no risk. It's just lower risk. Deaths remain low, fortunately, which is positive. I wouldn't expect those hospitalizations to translate into deaths for about another 4 weeks. But I am hopeful because of the evidence from the vaccination and the hard work the NHS has been doing, particularly around the clinically extremely vulnerable and those who are clinically at risk, to close the gaps, that we will weather this wave with a much lower death rate. Because of the protection that vaccination gives, but we do still have a significant proportion of the population who are unvaccinated and are in a higher risk category, so that could change. Situation wise, we're continuing to see large numbers of education clusters and outbreaks. We have seen fluctuating numbers of workplaces. And we are still seeing a number of situations coming through from care homes, but they are predominantly care home staff. where there are outbreaks rather than care home residents. I think the NHS and adult social care have done an amazing job to ensure the vast majority of residents in care homes have had vaccine and have received their second dose. We still have a way to go convincing some of the staff, and unfortunately that's where we're seeing the outbreaks continuing. And that is creating a significant pressure on my team, and we are looking to bring in additional resource next week to cope with some of the backlog. There's also been some changes in the national reporting system, which meant there was a delay in some notifications coming through, which has created further pressures on the response time. But what you can see is that over the last couple of weeks, we've started to see an increase in hospitality coming through as common exposures. And I do have some concerns about last night's celebrations. While I welcome England's win, I certainly could see a large amount of social distancing being ignored when it came to people celebrating with strangers in the street. And there is quite high risk that that will then translate into further case rate rises. We continue to see educational clusters, although not, as I said, linked to the classroom, much more linked to social networks between children and families. Contact tracing is going well and we have a good completion rate, and as Mark set out, we're working extremely closely with environmental health and the police. I think that's been a really successful initiative in terms of following people up, and we have brought in additional staffing resource to cope with the surge in numbers, which has meant we've been able to maintain this despite moving to over 2,000 new cases a week, rather than standing it down. And I do want to acknowledge the extreme hard work of my team responding to this, because rather than saying, no, we're going to stop and cap it, they have carried on, they've brought in additional work, they've worked additional hours to put the extra effort in to contain the spread of the virus, which is a real testament to their commitment to their jobs. In terms of communication engagement, finally, just to say this work continues. I'm very grateful for the support from our media partners. I also want to acknowledge the support from our partners when we feel things haven't gone quite as well as they could. They've been really positive in reacting and saying, how can we do this better? How can we work with you better? And I do want to give an acknowledgement to Birmingham Live, who really took on the chin some criticism about some of their coverage and are really actively working with us on how they can help us to get across messages about risk more clearly moving forward. And I think that's a credit to them as an organisation, but also reflects the partnership of the city and the city's media outlets to put everything together and to work with us on getting vaccination levels up and getting the right information out in a balanced way that gives people the information to make a decision appropriately. And I think that was real credit that they responded so positively to that criticism and so quickly. We continue through all our social media channels and working closely with our engagement partners, but also with our partners in the NHS to support the vaccination programme and to see what more we can do to tailor messages to local areas and make them very specific to really connect people with the support that's available. Our COVID champion programme now has over 800 champions. We also now have 34 youth champions, and it's been brilliant working with them as the vaccination programme rolls forward to already start to discuss with them how they would feel if they became eligible for vaccination, well ahead of it becoming a reality. So it's been brilliant to have Birmingham Youth Service work with us to support the youth champions alongside our wider champion footprint. Our engagement with faith leaders continue, and this has been recognised by MHCLG, the Department for Communities, Housing and Local Government. And now they've been sending a senior member of MHCLG staff to join those meetings because they want to learn from us and hear the feedback from both our interfaith group, our Black Churches group and our Masjids group. and it's been brilliant. They came initially after we asked a difficult question, and then they've decided to continue to attend because it's such valuable insight around the practicalities and the challenges of interpreting national guidance in the context of faith settings at a community level. So it's real testament to the work of Habibullah and Madupe and the engagement team who've been working with us on that. And we continue to work with our partners, particularly around the 15 high interest wards. Very grateful for members in those wards who've convened ward forums. Some of the initiatives, such as the work in Lascelles with councillors afar, mobilising community political volunteers to step up and help leaflet distribution and signposting to vaccination. It's a brilliant example and did play out, and we can now see in the Lascelles data has improved local uptake. And we continue to work with the NHS to identify other places to take vaccination support into churches, such as the God of Prophecy Church, which will be happening, both happened last weekend and will be happening coming up this weekend at a different site, to make vaccination as easy, accessible and as trustworthy as possible by working with local community partners who are trusted voices in their communities. I do want to highlight particularly our work with our partner Comms Plus, who've been doing British Sign Language translation and accessible support, and have recently worked with us to convert the self-isolation support pack and the vaccination toolkit into BSL. That's not an insignificant ask. Both of these are multiple page toolkits. And although we've been able to translate them into written languages pretty easily, translating them to BSL, which is a unique language in its own right, has been quite a specific piece of work, and I'm very grateful for Comms Plus's support in that space. We continue to do work to strengthen our partnership with communities. We are looking to further extend our engagement work with children and young people and commission new partners, and to grow the work that we've been doing and continue to build on it. COVID, unfortunately, is not going away, and although the 19th of July is the next step in the roadmap, it does not represent the end of the journey in terms of the COVID situation. Sadly, it marks the transition to living with COVID as we move forward over the next year. And so there will be a sustained need for work and response over the next 12 to 18 months as we vaccinate the world, as we continue to get a test before we go and do stuff, and we continue to have to unfortunately isolate to contain the spread of the virus. So I hope that was a useful overview for the board, and I'm happy to take any questions.
Thank you very much, Justin. A lot of very, very important hard work going on there. A lot of detail in the information you've given us as well. I'll just reiterate that although it is it's somewhat rare for England to beat the Germans in a tournament football match, people do need, in spite of the excitement, to continue to follow all of the rules. Hand space, that still all applies. And will apply on Saturday when England take on the Ukraine in the quarterfinals. So again, I would appeal for people to continue to follow all of the rules. If you're going out to a bar or a restaurant, make sure you are wearing a mask when you're not seated at your table, that you regularly wash your hands, and that you maintain a safe distance. That's the way to keep everybody as safe as we possibly can. We all want to get behind the England team, and we all hope they can go on and win this particular tournament. But we've got to keep people safe while they're doing it. Okay, I'm not seeing any hands. Is anybody?
Leader, can I just add to that, the important, our new buzz phrase or hashtag for this is lateral flow before you go. It's a really important message. If you are going out to watch the match, please do a lateral flow test before you go. It's a really good way of finding out if you're infectious, and you might just go and spread that round. And I think the lesson from the Scotland match that we're now seeing play out in the numbers is a really important reminder. So lateral flow before you go should be our hashtag for the next week.
Very good. Thank you for that, Justin. Okay, if there are no questions, we'll move on to item 7, the vaccination rollout and uptake. And we have Maura Gates, Project Director, University Hospitals Birmingham, NHS Foundation Trust, Dr. Parmjit Maroc from the Black Country and West Birmingham CCG, and Pip Mayo, the Managing Director of West Birmingham CCG to take us through all of this. So first of all, Maureen, I'll hand over to you.
Thank you very much. And I have to say thank you to Justin, because he's covered quite a lot of the information that I was going to cover this afternoon. And you'll have to forgive me. You can tell from my accent that us Scots were responsible for spreading the virus, and perhaps less happy about some of the results of last night. I think it's worth noting that in across Birmingham, we've now delivered 1.3 million vaccines. That's probably around 300,000 vaccines to people that don't live within the city of Birmingham or Solihull in our case. The split is broadly 750,000 of first doses, and we're just doing about 400 of second doses. But we continue to vaccinate people that are not from Birmingham, quite rightly, because they visit our city or they work within our city. As we've moved down the cohorts, we are definitely now beginning to see hesitancy from our youngsters. As Dr. Barney said, we've seen outbreaks amongst our students. We have, however, had a week of vaccinating students. We've had a targeted event across all of the universities. We have a tent in the university grounds today. And we will, of course, be going back there if the students are still within Birmingham once they've had the elapsed time between being positive and having to get the vaccine. But it remains a group that we are targeting and focusing, but we all need to encourage to come along and get vaccinated. On top of that, obviously, we continue to target the 15 wards, and we're doing that in the main through our community pharmacies, our local vaccination services and GPs, and of course the roving models through our vans. Very grateful to all colleagues who've helped with the communication around the mobiles and the walk-ins in particular, and we definitely see evidence of the communication improving uptake in our most vulnerable communities. Albeit I would say that sometimes the vans go out and we may only vaccinate between 40 and 50 people, but the view that we take is very much that's another 50 people that are safe, and hopefully they go on to speak to friends and family to make sure that they're likewise safe. We talked about the clinically vulnerable earlier, or Justin did, and our local vaccination services in particular are picking up our clinically vulnerable residents with one-to-one conversations to try and find out why people are not coming forward to be vaccinated, and see what they can do to either dispel myths or to allay any fears that people may have. We continue with the 3 mass vaccination sites across the city. We have Millennium Point, Aston Villa and Edgbaston. Aston Villa did close for a few days because of the football, and Edgbaston has closed on a few occasions because of the cricket matches that have gone ahead there. But we've continued to provide coverage across the city. Likewise, I'd like to thank community champions and faith leaders. Faith leaders in particular have been instrumental in us being able to access some of our hesitant groups. And I think, as Dr. Varney said earlier, we have been to some of our faith centres, and we continue to target them now and in the future. I think my message is twofold. We still have vulnerable people out there that need to be vaccinated. It's important that people come back for their second dose, but we also must encourage our youngsters to come and get vaccinated, because we know that they are the groups that are currently have a high proportion of the virus, and they will spread it. So I welcome any help that members can give us in spreading that word to our youngsters and our most vulnerable communities. And I'm happy to take any questions. Or indeed hand over to my colleagues if there's anything further they would like to add.
Thanks very much, Maureen. Pip, anything from you?
I suppose maybe just a couple of messages to reiterate there. I think Morag's given a fantastic summary of the work that we've been doing right across the patch. I think we've been looking to increase the range of outlets locally, and also there are a lot of sites now that are offering walk-in vaccinations, which have proved to be particularly popular with some of our younger cohorts, so that as and when people get up and feel right, today is the day for my jab, they can go to one of the walk-in vaccination clinics and do that. And I know there's really good information on the Birmingham and Solihull website about where those are at all times, that's regularly updated, so people can see where they can access that. I think that's probably what I'd add. I know we're looking at, there's another agenda item that follows on from this as well about good practice. I don't know if we want to merge into that or maybe just pause for some questions now about the actual model in case there's any queries from the group at this point.
Yeah, thanks,
Chair.
I think we'll just see if Parmjit has anything that she wants to add, and then there is one hand showing. Parmjit, do you have?
Thank you. I think that was really comprehensive. Thanks, Morag and Pip, and thanks, Justin, for the initial presentation. It was really helpful and really has set the scene as to where we're at the moment and where we're heading. And it's just to reiterate the points that everybody else has made, really. There's three things here, really, when it comes to vaccination. One is the opportunity to get vaccinated, which we are addressing at the moment with all the fantastic work that's going on locally. And then the messaging, really, around the importance for the different groups to get their vaccinations done, and the vital information for the people in the younger cohorts, that it really is important for their own safety and for the safety of those around them. And then the other group is around the hesitancy, and the work that we're doing currently around ensuring that patients and the public are feeling that this is the right thing to do, and that any questions that they may have about the vaccination, there is an opportunity for that to be answered. And as we've already said previously, there's a lot of information out there via several different avenues in order to help with that vaccine hesitancy. So I think it really is the main message is to get out there and get vaccinated to protect yourself and to protect those around you.
Absolutely, echo that, and to anybody who might be hesitant, please do not listen to myths or stories. Go and consult an expert, speak to your GP or speak to those at a vaccination centre who can give you the correct advice. But I would encourage everybody to come forward and take the vaccine. It is the way to protect yourself and your loved ones. Right, we have a question from Andy Cave.
Thank you, Chair. It's more of a support statement, really, and just to add some value to the statements that colleagues have made around the importance of true community engagement around the vaccine programme. And just to highlight in particular, in West Birmingham, we chair a coordination group around community engagement, and very much that's looking at targeted work within wards, bringing together community groups and community leaders together with those delivery partners, so we can have real lead in time and support people to access the vaccination centre. And hopefully this will embed some sustainable community development work within our most vulnerable communities as well, for increased vaccination going forward as well.
Thanks, Andy. Okay, if there's no further questions, I think we can move on then to the agenda item that Pip mentioned a few minutes ago. That's learning from pilots and pop-ups. And again, I'm going to ask Pip and Parmjit to talk us through this. Pip?
Yeah, if I start off with some stuff and then we'll do a treble act on it again. I think in terms of picking this up, because clearly the thing that comes through in my mind is the joint effort that's had to go behind the vaccine programme to make sure that we can get the reach that we need. I think in terms of some of the work that we found to be effective, it is just the persistent multi-pronged approach. So it's about having as many outlets as possible. Justin covered off some of it, offering hours that people want to access in places that people go, delivering services by people that they recognise sometimes. So I know in terms of some of the pop-up clinics that we put on that have gone into particular BAME communities, we've made sure that we've got clinicians that speak the languages that match the demographics of the groups that we're going to go and try and vaccinate, etc. So that some of those barriers are broken down, I think, from the outset. And we can see that kind of really persistent effect, I think, is starting to yield results, and we are having some increased uptake now in some of our wards that were lowest to start off. I think where it's been most effective, and we've alluded to this all the way through, is that coming alongside clinicians have been community leaders, elected members, and sometimes the business communities as well. So we get that message going right the way through the community, that vaccinations are here, the vaccination bus is coming, and people can come forward and have it. I'll hand off to Morag in just 1 second, but I'll just share my screen with a little bit of something that we did with a group of young people. I hope you can see this. I'm very happy to share some of these. But we got some young people from some of our Black communities to do some work with us to create TikToks. And I won't pretend to understand TikToks. I'm not of the TikTok generation. But to try and set out what vaccines meant to them, or possibly more importantly at the time we were doing it, to their family members. And you can see there's one young girl saying outfits I'll be wearing on holiday once I've had my COVID vaccine. And there's another one who does a really nice kind of dance about this is what I do when my family and friends agree to get the vaccine so we can all go back to normal. So we've been trying to use some of the young people as our messengers, and there's been actually a huge amount of hits on these TikTok sites. So if anybody understands TikTok, I'm very happy to share the thumbnails, except I'm sure that's not the right phrase, so that we can continue to kind of push those out through the social media sites. But some great stuff there, and the young people really enjoyed it, and I think the learning that they got out of it was fantastic as well. So I will just unshare my screen so that Morag maybe can pick up a little bit on some of the work that you've been doing more specifically around the pop-ups. Thank you.
Yes, thank you. I think that across the programme, we've actually been using mobile vans and pop-up clinics since the very beginning of the programme, so looking back to earlier on in the year, because we recognised that there were marginalised communities that were never going to access either a big site, a hospital hub, or their GP practice. And so whilst the importance of the pop-ups has been heightened recently, I do think it's worth us reflecting that actually we had been running at least 1 or 2 vans within the Birmingham city region right the way through the programme, because we wanted to make sure no one was left behind and that there was equality in offer to people. And I think Birmingham has probably led the way in some of that, because I know certainly other cities have used pop-ups latterly. But we were using them right across the city, across the whole of the programme. And again, I think the communication has been much better recently as we've engaged with more people, and that's certainly a piece of learning I think that we need to take into the winter, with whatever that might bring us, the importance of engaging with all stakeholders, elected members, champions, and patient groups.
Thank you both. Again, Parmjit, is there anything you wish to add?
I think they've covered it, actually. Thank you very much. Thank you.
Oh, well, thank you both. I'm not seeing any hands, but I do think innovative ways we've come up with of trying to engage with people and make it easier and easier for them to get vaccinated is definitely the right approach. We still have several tens of thousands of people over the age of 50 in Birmingham not vaccinated, and we've just got to keep going, I think, trying to persuade them to come forward, reassuring people if they have any hesitancy that this is safe and indeed is far safer than leaving themselves at risk of contracting the virus. So let's learn the lessons that we've learned thus far, but keep going and try to get this vaccine into as many arms as we possibly can. Thank you both very much. That takes us to public questions submitted, and this month there have been no questions submitted from the public, so we can move on to the test and trace budget overview. And Justin, you're going to present this.
Thank you, Leader. So the paper is up on the CMIS platform, and it's really just to note the spend against the budget. I suppose the one thing I want to highlight to the board is we have been well judged in some of our planning for this budget, particularly the testing contingency budget that we built in. To date, we've been able to claim reimbursement from the Department of Health for the community testing programme. However, from tomorrow, there is a change in the national tariff, I suppose, system, which moves to a model in which the tariff is less and is focused purely on a specific element of testing. It doesn't cover any of the logistics, any of the storage, any of the management of the testing service. So that means that over the next 3 months, we have continuity of the testing programme until the end of September, so far currently confirmed. That will create a cross pressure on the budget of about £280,000 for the workforce, the logistics and the delivery of the testing programme over Birmingham. So it is very fortuitous that we put aside a provisional budget to support asymptomatic testing of 1.1 million in this financial year. So I just want to highlight to the board that that will be coming, and I expect that cost pressure to start to show from the September board in the statement. The board will also remember that we profiled the budget to take us through until the end of September 2022 to provide the additional capacity both in public health and in environmental health to ensure that we had a robust response in place to support the Commonwealth Games. And although I very, very much hope that COVID will have reduced to the level of seasonal flu by the time we get to 2022, it is prudent to ensure that we do have surge response in place, not just for COVID, but also for other challenges that may come. So that's why the budget is profiled in that way. But I thought it was useful to remind the board why there are the two columns, one for 21-22 and one for 22. What will be 22-23 financial year. There are some things where invoices are still to come in, but this budget reflects the spend to date from the beginning of April. And as you can see, the majority of spend to date has been on staff, which is what we would expect. We will be drawing down from the contingency budget to support some of the spend in the enhanced response wards, the 15 wards where we're doing additional work, because that is not something we think we can claim back from the Department of Health currently. So it'll come out of our contingency budget, but we should it should only be about £300,000 to £400,000. So we remain with a healthy contingency, and we also managed to retain our Wave 3 response fund should we see further surges in the autumn and winter. So we are prepared for that in terms of the planning. Happy to take any questions on the budget, and I hope that the board feels that this transparency around the spend is useful.
Thanks very much, Justin. It's indeed useful. I think we should thank you actually for your very prudent oversight of this budget and putting us in a position where we do have resources going forward to deal with the ongoing situation. I'm not seeing any hands on this. So we'll note that then and move on to other urgent business. Does anybody have any other urgent business? Yeah, I'm not seeing any hands. So date and time of the next meeting. Our next meeting of the Local COVID Outbreak Engagement Board will be at 1400 hours on Wednesday, the 21st of July. And it will again be an online meeting conducted over the Teams platform. I now need to move then the exclusion of the public because we do have some private business to discuss. So in view of the nature of the business to be transacted, which is exempt information, I move the public now be excluded from the meeting. So could you end the live stream, please?